All right, we are recording this Tuesday afternoon. Welcome back, everybody. Feel like it's been a minute since I was here. I think Jody had a show without me, and I know we had to postpone this one. So thanks for your patience and welcome back. For those of you who don't know, my name is Jane Voorhees. I'm one of the admissions representatives here, assisting you guys get you ready for a successful interview. Whatever questions you've got. I've been with SCNM. I originally started here in 2007. And I took a little break from 2013 till 2019. So now I'm right back in this admissions role. So I know plenty about the program, naturopathic medicine. I love to share and I love to hear your stories too. So there's a little bit about me. One thing I do want to encourage, we are recording, but we want you to turn on your cameras, chat with us, use the chat feature to ask some questions. We're gonna, get the ball rolling here in a moment, but we really want you to engage and tell us what's on your mind and let us know what questions you have for Dr. Gerstell, especially as we dive into a fun conversation around research happening here at SCNM and in the desert in general. So, all right, that's enough about me. Jody, if you want to say hello.
All right. Good afternoon, everybody. My name is Jody, so I work very close with Jane. So we kind of divvy up the alphabet. I work with last names A through L. Jane works with last names M through Z, but we do the exact same thing. We have the same passion as you do. We love to get you guys started in the program. Absolutely love what we do. So I have actually been with SCNM since 2006. So just celebrated my 16th year. And like I said, I absolutely love what I do. I love talking to you guys from the very beginning and watching you as like Dr. Gerstell as being part of our alumni. So been out here in the Valley for 20 years. My family and I originally moved from Indiana. So I absolutely love it too. I am definitely ready for it to cool down a bit going into September. I know that's right around the corner. So again, welcome. Bring your questions, put them in the chat, or just turn your microphone off and ask a question. We'd love to hear from you guys. So I always share a core value with everyone. Core values, of course, are beliefs of our institution. So today I picked We Shape the Future. The future is you. We are fortunate to work side by side with each of you and help you along this amazing journey. We assist in counseling you from prerequisites that will prepare you for this program, as well as give you the foundation and the help that you need to be successful. Remember, you are the future of healthcare.
Well said. That's so true. That's it.
Yes,
That's what
it
we
is.
do every day is just help you guys become like Dr. Gerstell, become the future of healthcare. So many people need you. Jody and I, we are not doctors. We are not scientists, but we're having a blast here helping you do what you do best. Well said. Thank you, Jody, so much. And I mean, shaping the future. Like I love that you picked that one today. We're getting so close to drum roll. You guys know we're becoming Sonoran University. That's also big for our future here. So I think that's exciting. Yeah, super cool. All right. Well, so thank you, Jody, for sharing core values. The next thing we want to do is introduce our guest speaker today. All right. I want to pause for just a moment because I think it's Gerstell, but Jody says Gerstell. How do you pronounce your last name?
Gerstell.
Okay. All right. Gerstell.
Yes.
Gerstell. All right, everybody, this is Dr. Joanne Gerstell joining us. She is an alum, of course, of SCNM, but I've got a couple of fun tips or notes about her background. Born in the Philippines, she lived there as well as Singapore, but now, of course, Tempe, Arizona is home. As you might have guessed from that bright yellow wall in the background, she's an ASU graduate from Arizona State University. So she's been in the Valley here for a minute. Majored in biology and psychology. Graduated, as I mentioned, from Southwest College of Naturopathic Medicine. Graduated in 2019. And outside of the lab, her hobbies include reading, writing, hiking, and rock climbing. Indoors, of course, right now it's pretty hot outside, but you got to stay hydrated. So welcome. Thank you for joining us today. Anything else you'd like to add? A little bit about your background?
Oh, well, thank you for the great introduction, Jane. I mean, that's mostly everything about me. And I know we're going to get into like the research and the practice and like the, I guess, half and half type of jobs that I have since graduating from SCNM.
Perfect. Well, we're happy to have you.
Awesome. So I'm going to start this fun research live with Jane and Jody. So being an alum, Dr. Gerstell, I always ask, how did you become interested in naturopathic medicine? Let's start there.
That was a very long journey. I was actually, I was pre-med when I was an undergrad here, and I had been studying for the MCATs, doing a lot of shadowing in the hospitals. My third year, it's like the fourth year of undergrad, I came across Jody. She was at ASU. They were marketing SCNM, and I fell in love with everything that they had to offer. And I just thought that medicine that naturopathic medicine can provide was like something that's very futuristic. I know it's kind of like going back to the roots that I needed to head towards, especially with what I was seeing in the hospitals, patients coming in and just they had a cold that they could have managed at home, or like patients just coming in for the same things over and over, and there wasn't any like dossier or any like information being provided to be able for them to take care of themselves and not have to keep coming back in. Unfortunately, after talking with Jody, I had brought this up with one of the graduate students that I was working with back then at ASU when I was an undergrad, and they like completely dissuaded me from going into it. They were like, don't do it. You're not going to be able to make enough money. Naturopathic medicine is a bunch of hoo-ha. And he sent me like all these research articles of like how it doesn't work and it's not going to help you. So I got scared from that and kind of depressed about it actually. And in my fourth year, I was still like applying to medical schools, but it just didn't feel right. So I decided to take some time off after graduating from ASU, and I went to work in the mental health field. Actually, I was a health and wellness coach and also a case manager in behavioral health. So I did that a few years. And while I was doing that work, SCNM came across my path again. Jody had reached out to me.
You don't give up.
Jody knows me from like way back when. And I was like, this school keeps popping up. You know what? I'm just going to check them out again. And I took a campus tour. I just fell in love with it. And I was like, to heck with it. I'm just going to go for it, apply. And I went through with the program because it just, life keeps throwing this back in my face, and we'll figure out what will happen with like the financial aspect. And I truly believed in the medicine. And I know that if you believe in something, the finances and other stuff business-wise will work out. So that's how I ended back up at SCNM.
Yeah, we don't give up, you guys. If we see the passion in a student and we know that whether then or later on, I've had many students come back to me. So good. Glad you did.
Me too.
Thank you for sharing, because for sure you're not alone in your friends will tell you, wait, what are you doing? You're crazy. There's no validity. Yeah. There's so much that we have to fight against and really prove to ourselves that, no, there's so many things that you say, like dossier, like we have to teach other people. Thank you so much. I love to listen. Yeah. Yep. Right. Your story is a lot like others. Yeah, for sure. Thank you. Thank you for sharing.
Yep. Absolutely.
So Dr. Gerstell, before we go directly right into the research, can you explain a little bit of your role? I think you're here at the SCNM campus, but for those of you who aren't aware, we're literally 7 miles from Arizona State University. We're right down the street from the Biodesign Institute, which is we can collaborate with a lot of different research projects. So can you explain a little bit the questions that I kind of inserted after we wrote these in that were like, are you working at SCNM? Are you teaching at SCNM? Are you volunteering in the lab? Like, what's your role at SCNM? And same thing over at ASU. Do you teach there? Are you doing research there? Is it one and the same? Can you kind of explain the difference in the relationship?
Yeah, definitely. So right now I'm a PhD graduate student at ASU. So after graduating from SCNM in 2019, I took my boards and then I hopped into my PhD program, which is in molecular and cellular biology. So I have a passion for both research and seeing patients. This was always something that I had planned out. And I had worked with Dr. Langland, who is the head of our research department at SCNM. So I think since like quarter one or two, had been in touch with, but I didn't know until quarter three that you can do a PhD after your medical school program. So I learned about that from a micro lab teacher who was doing the SNM program, and she was going to go do the PhD, which funny enough, I am now the micro lab instructor at SCNM.
Wow.
So when you guys get to quarter three, Dr. Langland teaches the micro lab lecture, and I teach the lab portion in quarter three. So I'm adjunct faculty at SCNM, and I still do research with Dr. Langland. We do a lot of my thesis at ASU while I'm getting my PhD is centered around botanical medicine and a little bit about oncolytic viruses for virus treatment, basically. So it's a little half and half. So while I'm at ASU, I also have to teach. So I teach both at ASU and SCNM. It's part of like the PhD graduate student experience. So on top of all of that, I also see patients in my free time, right? So I see patients like 2 days out of the week, usually Mondays and Saturdays. And most of my practice centers around, I go back to my mental health roots from when I had taken that break after graduating. So I do a lot of mental health counseling, I utilize a lot of like acupuncture, nutrition, energetic type of modalities like craniosacral and Reiki, but it's more like, yeah. Hopefully that kind of provides a quick gist of.
Yeah, I had no idea you were that busy, right? And you're still a student. I mean, you're a lifelong student for sure. You're still always learn something new every day, I'm sure, in what you see in your patients and
Yeah.
what your colleagues share too. Thank you so much. Yeah, I had
Wow.
no idea.
Yeah.
And are you seeing patients here at SCNM, or is that a private practice?
Not at SCNM. It's at a private practice that's like 5 minutes away from SCNM. It's called Zan Medical Clinic.
Oh, nice.
So it's with another SCNM graduate.
Dr. Simonson, that sounds
Yes,
like private
Dr.
practice.
yes.
Yeah.
Awesome.
Exciting. Love it.
Good for you. Good for you.
All right, looks like we have some questions. I feel like I could just sit here and talk with you all day, but let me actually see what our guests have to say. Yeah, I'm glad you're with us now, Susan, for sure. Well, no, everybody's just excited. We're all excited. So Jody, why don't you dive into our questions?
So let's start with the whole research background. How did you get interested in research, first of all?
I did a lot of research in my undergrad. So research was one of those checklist items that you had to do for pre-med application.
Okay.
So it was something that I had gotten into. And in my undergrad, we did, what was it? It was a lot more like neuroscience related. So we were actually looking into the effects of various drugs like cocaine, heroin, and how they affect the neurons in the brain. So I actually research, and I just fell in love with it, and I didn't want to leave. So when I started back to school at SCNM, I knew I wanted to keep being involved in research. So that's why I had reached out to Dr. Langland when I first started here, and he was like, yeah, totally, you can volunteer with the research. And since I had an experience in undergrad, I was able to do a lot more advanced research with him as well. And like I said earlier, I didn't know that I would go on a PhD until like Q3 of medical school when I found out that that was even possible. Because I know usually there's also those programs, the MD, PhD programs. So we're trying to get that set up for SCNM as well, where if students are interested, once they graduate from SCNM, that they can go into a PhD program and like basically hit the ground running because they've been working with Dr. Langland.
Wow. Interesting.
That
knew?
with Sonoran University on the brink here, like that totally sounds like that's possible, and it could easily be put together, right?
Right.
Like we have the partnership with PIMA for the LAC. We have,
Right.
our partnerships out there. I think that's fantastic.
Right.
Neat. So when you talked about doing research in undergrad, were you working with Dr. Langland while you were studying at ASU through your whole entire undergrad before you even came to SCNM?
No, I didn't meet him until I started at SCNM. So my research in undergrad was with someone completely different. He's still a professor actually.
Oh, wow. Awesome.
I just remembered that we kind of stole Dr. Langland from ASU.
Oh, that's right. Yeah.
We did.
Yeah.
We did.
Like I said, yeah, go ahead.
No. I was just going to say, so part of the research at SCNM, I do know that students are required right off the bat in Q1 taking a research class. Okay. Yes. But so they talked to us a little bit about above and beyond that, because I've had students even ask, is that, how do I get to volunteer? How do I get myself, interested, showing everybody that I'm interested in research or whatever, to where they're doing more than just that one class?
Well, so you do have that one class where most of it is you going through research papers and understanding how to interpret research papers, because not every research paper that is published actually has good information, right? So you're being taught how to interpret these papers and these articles in a discerning manner, because this is what you're going to use as a doctor when you're looking into treatments for your patients. So this is like a great class to practice that. You also practice like presenting in a group, which as a future doctor as well, it's great practice for you presenting basically to your patients, your results and things that you found and why you're doing certain treatments. So you have all of that in that one class. Now, if you're interested in like volunteering for research, basically Dr. Langland, and he will get you set up with like the volunteering he'll probably start you off with the class-wide volunteering, well, not class-wide, school-wide volunteering, where you have different students coming from like different quarters, and you guys come together and you work on that particular project for that quarter. It's nice because then you get to meet other students from other quarters and just chat with them, because you all come in during like lunch hour to work on those projects. Now, as long as you're like showing up and you're consistent and you're actually having good like research while you're doing that, you can start to like talk to Dr. Langland. Hey, I kind of want to do more things, or I want to be more involved. And as long as you're showing like consistency, then he'll like, the more that you're responsible, the more responsibilities are given to you, basically, right? So you have to show that you're responsible and that you're willing to put in the work and the effort for it. Yeah, and just talking with us and letting us know what your plans are and telling us like, hey, this is what I want to do. And so we can help support you in that process.
So a student could possibly be part of the research department all 4 years if they wanted to.
Yeah, that's what I had. Basically.
Okay. Awesome. So, I mean, and this is not a negative question whatsoever, but why is research important? Sorry, Jane, I'm taking.
Yeah, it's perfect, Jody. No, keep going. I love it.
Well, it's especially important in our field where, like I mentioned in the very beginning, people just oh, that's a woo-woo medicine, it's not going to work. It's really nice to be able to have the evidence behind what we're doing. And what's cool about the research that we're doing at SCNM is we take like botanical medicine and what they've been traditionally used as, and kind of see like, oh, is this actually how it works? Like we figure out the mechanism, if it actually is an antibacterial, if it is an antiviral. So we kind of put the evidence behind the traditional uses of things. And benchtop research, so the type of research that I like to do is benchtop research, where I go in, I work with cell culture systems, viral systems, and just do like infections, plaque assays, all of the, I guess, research techniques that you could think about. There's also clinical research where you would be basically testing your product on patients. So you don't necessarily need a PhD to be able to do clinical research, because you can do that as a doctor, but it does help having like, when you're applying for like grants for like clinical studies, and because it kind of puts more oomph behind your name, basically.
Okay.
But I have seen naturopathic doctors be involved with other PhD people and other medical doctors in a clinical trial. So it's not, you don't have to have that PhD to be able to do that. I don't know if that answered your question, Jody. I kind of went off tangent.
Yeah, right. I mean, I think the most important part, is the evidence-based. You have something to back up what your research. Right. Absolutely. Very good. Thank you.
It absolutely is important. We are almost touched on something there at the end. I'm curious, is there a lot of integration? Like, I don't even know right here in the SCNM lab, how many NDs are there? How many PhDs are in there? How many, I think Dr. A just left. Like we have doctors from all over the world. I realized he was from West Africa. I just learned this amazing gentleman was here and he's now gone.
Dr. Abiola.
Yes.
Yeah.
Yeah. I said Dr. A. Yeah.
So right now, and it's really nice because SCNM just recently got this lab. It's brand new. All of the tools are brand new and it's great. It's really nice working there because you don't have to worry about the machine breaking down on you or anything. But there is Dr. Keeley. I don't know. I think she TAs for a few courses. I'm not entirely sure. I know she does she helps out with acupuncture lab, I think, and phys med lab. So Dr. Keeley is there, and she's a naturopathic doctor. She's one of our research scientists in the lab. And then I think everyone else is a PhD. So we have Dr. Susan, Dr. Bobby, and I don't know Dr. Abiola left already. And of course, Dr. Langland. And we're planning on hiring a new person to replace Dr. Yalda, who was the other research head. So our lab at SCNM is broken up into two components. We have the bioassay lab, is the part that I work in, where we do a lot of assays with cell culture and viruses, all that type of work. And then the other half of it is the analytical chemistry lab, where Dr. Bobby and Dr. Yalda, who was previously here, they do a lot more of looking into the chemical structures and which actual constituent is the active component in that botanical. So they do a lot of NMR, liquid chromatography, those more analytical component of things, which I'm not a whole lot about. It's not the type of research that I like to do, but God bless them. They love doing that stuff.
God love you all. This just goes right on over my head.
I think Lakita had a question.
Yeah, you can. Great, go ahead.
You're amazing. I was listening and I was wondering the entire time how the clinical aspects for your journey would be as you go further into your bench work. And then you explained how sometimes having the clinical aspect would prove botanical medicine and going through that process. But for you personally on your path, what would that look like 5 years from now when you are seeing patients? Or do you think it'll be isolated by then?
So are you asking if I'm going to be able to transfer like the benchtop research to the clinical, like bedside treatment, basically.
Bedside, and if in any way that will make a difference with your day-to-day interaction with your patients.
So here's like an example that we have. We have this acne cream that we had been developing at SCNM, and I was able to do like a basically mini case study, not technically a clinical trial because we didn't really have that many people, but we did like more of a case study where I saw patients who were specifically coming to see me for acne. So we had opened it up and we told them, hey, we can try this treatment and you just need to document it. It was just a few, like a small case study of people. And so we gave them the cream and they just took, they came in, I would take pictures and note those things. So it's really nice to be able to do that within like my own clinical practice. I also know the medical center at SCNM has also been able to do a lot more like wide scale clinical trials. So we also have this different cream that we've used for like herpes and what do you call it? HPV, that we've worked with doctors at the medical center to be able to use them or test them on the patients and have them use the treatment. And we've gotten great case studies from that as well. So I would love to be able to integrate that, like developing a product bench side and then putting together this treatment and then being able to take that to my patients and seeing like how they respond to it, how it works, and make changes, and going back to like the lab to be able to do that. It's a lot to be able to manage that. And I don't think it would be in probably different phases. So I would probably be busier in the lab while it's being developed versus in the clinical trial. I'd probably, or the case reports, I would probably be doing more work in the clinic at that point, right? So it's nice that SCNM gives me like the flexibility to be able to do that.
Thank you.
Yeah, of course. And I think Cynthia has a question in the chat.
Yeah.
I do. You just want me to read it? Yeah, the research opportunities are great. I'm really impressed all the flexibilities you have in doing different things. And I was wondering, has there been any research or studies that you have done or are aware of regarding breast cancer, like treatments or pain management or wound healing?
I know for pain management, we had looked into cannabis to help with like pain management. I know there's a few, I think we might be currently working on something in regards to pain management. Same with the wound healing for like research in aspect. Not so much the breast cancer yet. Yeah, I think more we have stuff going on with pain management and wound healing, but not the cancer aspect. A lot of cancer research, you can do them in cell culture, but a lot of it, like people want to see like research in animals, and right now we're not equipped to be able to do that. I don't know if the school wants to move in that direction either.
No, and in fact, I was in pre-med in my undergrad, and I had some deaths in the family, but one of the deciding factors of why I didn't take that route is back then it was very heavily animal studied, and I'm not interested in that. But I didn't know, being that we're more on the natural path here, what kind of opportunities they have in research that don't include animals and different aspects of learning more about breast cancer and that route without doing that.
Right. And we can certainly do that type of research where we just have the cancer cell line. So there's a lot of different cancer cell lines that we can work with, and we can just test those like either botanicals or whatever formula that we have on those cell lines to see if it like suppresses their replication and do like other assays on them. So there's certainly a lot of different ways to be able to test that. It's not just animal research.
Okay, that's interesting. Thank you.
Yeah, of course.
Interesting.
Great question.
Great. Keep your questions coming.
Yeah, it's right over my head.
I do
Go
have
ahead.
another one.
Yeah, keep
Um,
Go
going.
ahead, please. No, go ahead.
So I've been a licensed mental health professional here in Arizona since 2001. And when I saw the email come through with your mental health background, that really excited me because I love tying in, with the natural work, the naturopath work, the mental health component, because how many patients come to see you and they have mental health, issues or behavioral
Mhm.
issues with their children and they want to talk about it. So how do you foresee yourself incorporating that as well and what you're doing going down the PhD track? Because that's not something that everybody has, that background.
Right. And like right now, they're kind of separate, where my research isn't really focused on mental health aspect, and they're a little separate. And I'm okay with that because it stimulates both sides of my brain, so it keeps me engaged. But we are starting to do research into herbs that like putting evidence behind ashwagandha, for example, stress and anxiety. And that's definitely something that I would want to be able to let my patients know and be able to recommend certain supplements, or even if they want to do like a case report, and if we have a formula that we can put together and have them tested out. So hopefully the research does move in that direction, because we definitely need more like evidence and research behind alternatives to like antidepressants and anti-anxiety medications that have all of these different side effects that patients usually get. Because I saw so many patients when I was working in mental health where they were on 30 different meds and they started off with one, but then they started getting side effects, and you just keep adding on a medication, right? So it would be nice to get more research behind like more alternative and natural therapies, and not just botanical wise. Hopefully, like I know acupuncture has been great for a lot of mental health issues, and even just like what's that called? Like different types of mental health techniques like EMDR, neuro-linguistic programming. It's just whatever fits best with the patient, because not every patient is going to respond the same way. And that's why I think naturopathic medicine is great for that, because we have such a huge toolbox. We learn so many things, and it can be overwhelming, but it's nice to have it's not just, oh, I'm going to give them this medication for this. We have more options to be able to provide for our patients.
Yeah. Everything you said, I completely agree
Well
with.
said. Yeah, you have
Yeah,
all of our
that was
hearts.
great. Yeah, exactly.
We're all just sitting on
Thank
the
you.
edge of our seats. Keep talking. Truly, for sure. Like, and you said like the toolbox, man, and just the simplest things of nature cure. Let's just start with water and ice, before you even think
Right.
of nutrition or acupuncture. There's so many wonderful tools. It's wonderful. Thank you so much. What do you think the percentage of students at SCNM are involved in research? Is everybody wanting to dive in and fighting to get into that lab up front, or what's the involvement?
I know that might be a better question for Dr. Langland, because he manages and sees the students, but I know we can have up to like 40 to 50 students every quarter working on the school-wide project. And then we have like a few, like 5 or 6 students who may be working on more advanced projects, either in like the new lab that's set up at SCNM, or if we have to go over to ASU and use some of their facilities. So there's quite a bit of involvement. I know it's hard with the medical school schedule. It does rigorous, and it does get more intense as you go throughout the years. And some students, they kind of volunteer a lot up front, and then they kind of back down a little bit, especially when they start into clinic, because it's a lot to be able to manage your time. So yeah.
Good tip right there. Time management skills. Hone in, know your schedule, know your time. That's a really good tip.
Because she mentioned that, I actually have another question. How
Sure.
exactly do you manage your time, especially through undergrad and then leading into coming to SCNM and then getting into research? How did you have a mentor? Did you follow peer advisors? Like, what worked for you?
So I would have to say Dr. Langland was like my main mentor, especially like research wise. It helps being organized because I had a calendar that I would update and put in, okay, this is what I need to do for this time block. And notice I said time block because certain things kind of change. So I want to be able to be flexible. Obviously, classes, you have to be there. So I put those as like actual like standard time blocks. And then outside of that, I would put, okay, I want to do research during this time, or I need to like study during this time. So being organized and having a calendar, but also trying to be like flexible about if something changes or if something comes up. I also used this app. It was like my homework app in Evernote to kind of keep track of all of the deadlines for assignments and things. In the beginning, it was a lot, like every time the course started for S&M, I spent that first week inputting all of the assignments that were due, that were listed on the syllabus. It took a lot of time, and then inputting like my calendar schedule. But then the rest of the quarter, I could just follow off of that and stay on top of things. So staying organized, I definitely recommend that. And because that helped me. And with a lot of the chunk of time that students spent is studying, right? So once you actually have the way that you study down, I would it. I experimented quite a bit in the beginning with the first few quarters of like, what is the best way to study? Like the first thing I tried, all right, because I took handwritten notes at ASU when I was an undergrad. I thought that was going to work out at SCNM. Mistake. That was a big mistake. Because I would sit in class and I was like, I cannot write fast enough to be able to follow all of this information flow. And it was just, I can't. So I just learned to be able to take notes in the PowerPoints themselves. And if the teacher, and I wouldn't spend type up the notes that were already on the slide. I would just add the additional stuff that they would say on top of whether it was not on the slide or not. And then afterwards, I would kind of like use the PowerPoint to kind of review, maybe make my own notes and kind of organize it. So then I can just use it as like a quick reference whenever I'm studying for the exams. So the way that you study and how efficient you are will definitely help with time management as well. And once you have something down, I would stick with that unless you want to try it. I know some people would use like other people's study guides. I had tried that before, it did not work for me. I failed an exam. And I was like, all right, well, I'm just gonna go back to my own way of studying. So kind of figure all of that out now in the beginning so that you can use that later on for the harder classes. And also for when you're a lot busier, when your clinic schedule comes in, because when you're in clinic, your work doubles basically, because you have to be prepping for patients. You have to put in your chart notes. You have to see patients. It can be overwhelming on top of your classes that you're still taking. So those are just notes that from what I remember.
Thank you.
Wow.
That was very thorough and great guidance. What you keep saying like the harder classes. What's the hardest class?
I know everyone like dreaded Gen Med. So Gen Med, I forget which quarter you guys get that in. I think it starts quarter 3 or 4. Oh wait, no, quarter 4.
3. Yeah.
Yeah, somewhere around there. And it's, I tell my students this in micro lab, it's kind of essentially a weed out class a little bit. I don't like to call it that, but that's what we call it as students when we talk about it to other students. Just because it's a lot of material, a lot of information coming at you very quickly. It's all of your general medical diagnosis, all of your, basically, how do you diagnose this patient? What symptoms would you see? What's the mechanism? What's going on? So it's a lot of information. And there's 2 instructors teaching it still, I believe, Dr. Laskew and Dr. Howell. And the way that they teach is slightly different from each other. and the way that they test you on exams are also slightly different from each other, or very different, I guess you could say. So Dr. Laskew, he likes to have, he'll ask some detail. Overall, it's like a big picture question. Dr. Howell will be more detail oriented. And when you have a lot of information that you are trying to memorize and study, details are sometimes very hard to remember. And that's why a lot of students kind of have a lot of trouble with that class and with her exams. So that's something to kind of like keep in mind once you get into after the second year, because you have Gen Med all the way out throughout your second year. Once you finish that, like your third year, those classes, they go into like specific classes like pulmonology or wow, I can't even remember like the names of the classes now. I'm sorry. But like all of your ology classes where they're specific. The only reason, like they're not technically harder, but it's just hard when you have your clinic schedule to manage on top of that. So you kind of lose time to studying and it feels like the class is harder sometimes. And then you also get into the other methodologies like the phys med, all of like the botanical medicine. So on top of learning all of our different techniques, there's a lot of information. So it just feels like you're getting water hosed with information that you're like, I'm just studying to be able to pass this class, and that's okay. But just remember, you do like in that moment that you have to remember that for when you're taking NCLEX 1 and 2. So the more that you can kind of familiarize yourself and see the word, like the information over and over, the more that it'll just stick in your head and you're not just kind of short-term memorizing it, and it's more for like long-term. Yeah.
That's really great to hear, like your recollection of it, your experience of it. I mean, what comes to mind now is like, okay, at what point did you like, did the light bulb go off? Like, oh my God, it all synthesized. I'm a doctor, you know, like when you passed the board exam, or was there a moment when you were meeting with one of your patients and the SCNM Medical Center and realized, I get it. I know what I'm doing. I feel like I know what I'm doing. Like, when was that moment for you?
Oh, wow. I mean, even when I got my license and I passed the boards, that was such a big relief, but I didn't feel like a doctor. You know, I didn't feel like a doctor yet. And when I first started seeing patients and I was just getting into it in the first few months, I kind of still had that imposter syndrome.
Sure.
I was like, how am I doing this? I don't feel qualified. And I know I've seen patients, but I had like another doctor, like the attending physician, basically hold my hand through it, make sure I didn't kill the patient, but now it's just me. So you have all these thoughts. And eventually, like the more that you do it, the more that you see patients and you get to know them, it's more of like a relationship that you're building with them. Like I don't even care if my patients call me a doctor or not. Sometimes they'll just call me, hey, Dr. G, or hey, Dr. Joe. And that's fine. Build more of like a relationship with them to be able to help them with their health, because the patients are very intuitive. They know what's wrong with their bodies. And I see it more as like a working relationship where I'm not just the only one who's telling them this is what you need to do. I work with them into like, hey, what can I do to help you get to this end goal that you want? Right. So it's the more that you see the patients and the more that you interact with people, the easier, and you like just finally clicks, I'm a doctor. And I think it helps when you're going to places and you're just realizing, oh, wow, yeah, I am a doctor and I have all of these experiences and I have this knowledge, and it just kind of, I don't remember when it clicked.
And that's okay. That's okay.
Yeah. And you just start being more confident in the area that you're working in. And it happens over time. And you just realize, oh, wow, that's what I'm, this is what I'm doing.
That's awesome. Yeah.
Did you ever have any interest in doing a residency at all?
I did see someone asked about residency as well.
Yeah, thanks for
Yeah.
reminding us. There might have been questions.
I was thinking about a residency, but that was not something that I could actually, when I looked more into it, it wasn't something that I could do on top of the PhD program. Because the residency requires basically it's a 40-hour week, job.
Okay.
And with the PhD program and the research classes, it wasn't something that was manageable or that I could do. But
Okay.
I would recommend a residency. If I know SCNM has a lot of residency positions. There's some at the other colleges. Some clinics, I think some clinics also offer residency programs, because it's a great way to be able to get patient exposure and because the doctors usually, if it's a good residency program, the doctors would be able to let you kind of do your thing, but if you have questions,
Yeah.
you can still ask them. So it's a great way for you to build your own confidence in seeing the patients that you seeing patients and getting that, I am a doctor kind of click. So but still have a little bit of supervision. And if you can't do a residency, I would recommend joining a practice where there are other doctors that you can collaborate with, which is what I did. I had worked with Zan in the past, or Dr. Zan. I had worked with Dr. Zan in the past, and I had told her about my plans and what I was planning on doing with the PhD and how I could only practice 2 days out of the week. And we talked about how I would fit within her clinic. So she's great to work with, and it fits really well because she does a lot of pain management, regenerative type of medicine. She hates the mental health. She knows mental health is important, but she does not like doing that. So she's very thankful that I'm there to kind of do the mental health component for the clinic, which works out perfectly for us because she also does a lot of hormones, and I'm not a big hormone person. So whenever I get patients who need hormone management or injections and things, I always refer them to her. But it was nice to be able to have another doctor where I could bounce ideas off of. It wasn't a residency per se, but it was more like a working clinical environment where there are other mentors and doctors who had been in practice a lot of me that I could ask for information from.
No, I think I said this earlier, student for life, you're always learning something new and learning from your colleagues and stuff.
Right.
It's great to have that partnership. Yeah.
Yeah. And definitely when you're starting out in your business, I know not everyone has that business minded aspect or how to even start that up. And I know that I was that person because I was no idea how to start one, no idea how to manage finances and things. So it was super helpful for me. I mean, we get a few classes here and there, but I didn't feel like it was enough to actually be confident in opening up my own practice and have my own building and all of that. Especially on top of the PhD, I was I'm not going to be able to manage that, and I'd be losing money seeing patients.
Right.
So it was helpful to be able to see how a business is run and what goes into it. If you're going to have supplements in the office, what type of how charting is done, what type of EMR program, and how to order all of your supplies and just gloves and basic things that you would keep in the office, so that's helpful as well. And I'm hoping we can also get more residencies in other environments, maybe in a hospital setting or other clinics, so that we can have that more available for students. And Lily, I think I answered your question about if it would have been beneficial to do a residency. I think I mentioned earlier, if you have that, if you can do it, I would definitely do a residency. But if you feel confident or if you want to join another another practitioner's practice, I think that's also another route to go. So it's not just one cut and dry route, which is what's nice about naturopathic medicine is we have all of these different ways that we can go out and start practicing. And it's not just you have to do a 4-year residency. But with that being said, it's also kind of like a con as well, because for some people, they and dry route. So it makes it harder for those students and future doctors, right?
Good stuff. Gosh, from the perspective of the student, that experience from, you know, all right, now that you've graduated, setting up a practice, the partnership out there. All right, guys, we got 10 minutes left. Definitely get some questions out there. What comes to mind for me? I'm looking across our list.
I'm interested. I'm sorry, Jane.
What
I'm
was like,
interested.
yeah, go ahead, Jody. Now we're going to fight for your time.
Do you know what type of research projects is going on right now at SCNM?
Yes. So we have a few, and actually I'll put a plug in for research night. So
There you go. Yes.
Research night is coming up. It will be October 6th, I believe, in the afternoon around like 5 p.m. or so. It's going to be, I believe, virtual, because I don't think they were able to get that set up for in person yet. So a lot of the presentations from Research Night is going to center on things that we're currently doing at the SCNM lab. But just to give you an idea, so we have a few different projects. One of them is ashwagandha, and we are looking into how it's going to help with stress and anxiety. We also have another one. We're working with a nutraceutical company where we're testing their product to, what's that called? Basically for like collagen synthesis, and also helping for like GI issues as well.
Okay.
There's another project. I know the name of the project. They're also looking into like various like skincare products to see, or not products, but botanicals that would be useful for skincare and aesthetics. There's also the cannabis that I think they are reviving, where we're looking into like there's like sleep studies, anxiety, mental health in the aspect. And I know that for the analytical chemistry, I know they've been looking into echinacea and active constituents for that, because we're also doing echinacea and how it's an antiviral and mostly like antiviral for like rhinovirus, influenza, and a few other cold symptoms, or cold, not symptoms, but for colds. And we're also breaking down, what was it, Artemisia, where we've been using it for SARS and other cold-based viruses as well. So they're trying to figure out the active constituent for that. So there's a lot of different projects that we have going on. And every time we have research night, we try to showcase the most current ones and which ones are relevant, I guess. So yes, we definitely have a lot.
A lot going on.
Yeah. So Agatha had a question about marijuana work in Arizona. We are actually not using medical marijuana. So with research, we're solely focusing on like the hemp and CBD aspect, not really the THC. So we're not going into the THC component. I don't know if we have plans on doing that, but I know our initial research has solely focused on like hemp and CBD. And I think like legislation in regards to research for THC products with like medical marijuana is still a little iffy, because there's some like regulations about that, and there's a lot of like background work that needs to be done in order to just be able to do research in THC.
Interesting. Awesome. Do the students pick the research project, or is that Dr. Langland, or how are those picked?
So for the school-wide one, Dr. Langland usually chooses.
Okay.
If you get involved in the more advanced research projects, you just tell him what you're interested in. And if he has a project that fits or is kind of close to it, then he can kind of match you up with that particular project. There
Gotcha.
is an application process to be able to be a more advanced research student. So that's changed a little bit since I had been going to school there.
Okay, very good.
It must be
think
obviously
have a-
more and more people are interested. Yeah, go ahead. I did see Lily's question. Do you want to respond?
Well, Audra also had a question. Are there any particular subjects you need to excel to get into research for lab? So I absolutely hate chemistry. I also hate organic chemistry. It was not my best subject. So those are things that you don't have to excel in the class to be able to do research. If you have an open mind and you're willing to learn at it, you can teach yourself, kind of like with being a future doctor. Things are always going to be changing with treatments, right? As long as you're open-minded and you're willing to learn about these new things and be able to evaluate, is this something new that I want to try? Is this a new treatment that would be useful for my patient? The same in research. Is that like, what assay is this? How does this assay work? Can I actually utilize this for my experiment? So you don't have to know everything to be able to do research, because you kind of learn things the way. If you let us know, hey, I don't have a huge background, we can get you started, work your way up. And if you're, interested in doing that type of research, because everyone has to start somewhere, right? And it's things that you learn in class can be applicable to the research, but a lot of the time you can just learn it while you're actually doing it, which a lot of people learn better that way. Kinesthetic, right? Let's see. To Lily's question, in regards to the ND curriculum, is the cannabinoid system covered? Oh, I'm trying to think if we ever we don't have a specific class for the endocannabinoid system. I think it might have been briefly mentioned in one class, maybe. I can't remember. It's not something that we cover in depth, not in our particular classes. We might get like in botanical medicine, sure, when we do like the cannabis part, I think it is brought up in that specific portion, but we don't have an actual class for it.
With Dr. Gaines?
Dr. Dang is acupuncture, right?
No, Gaines, Gains.
Oh, Dr. Gaines, and I think Dr. Stage also does a portion of botanical medicine as well. I think.
That's
Well,
right.
that's what I had classes for her.
Agatha, go ahead, jump in. You're muted.
Thank
though.
you. I'm so sorry. I missed a little bit of the beginning of the meeting regarding just because of my time change and everything. But I was curious about, you were speaking about residencies and then you said 4-year residency, and the residency isn't necessarily required, correct? But you did feel more comfortable in opening a private practice after you concluded this residency program.
So I didn't do a residency.
Okay.
And I believe, so each residency might be different. There's some that are 1 year, others that are 2 year. I think when I had mentioned the 4-year, it's like the usual residency for an MD, like allopathic program. For naturopaths, I had mentioned earlier, it's not required, at least not yet by the board. I know there's been talk about making residencies required, but they are kind of going back and forth about that, because first they need to be able to have more open positions or more open residents to be able to do that if they're making it a requirement. So there's a thought that's been going back and forth. And I said an alternative to residencies would be joining a practice that's already been established with other naturopathic doctors, because then you would still be seeing patients kind of on your own, and you can build your own way of practicing that way, but you have other doctors to be able to bounce ideas off of. If you get a patient where you're like, I have absolutely no idea what I'm going to do, have you guys come across something like this before? So that's an alternative to residencies if you don't want to go that route.
But did you feel comfortable going into practice without having this extra residency training?
I don't think I would have been comfortable either way. I feel like even after residency, I don't know, because I didn't go through residency. I feel like even after residency, I might have still been uncomfortable just going out there, because even as a resident, you can still ask your attending physician to, because they would still have to like sign off on things, right? You would still ask them for advice on, is this treatment good, you know? So when you're out there and you're just on practice, it's still slightly different, and there's always going to be a level of uncomfortableness when you're in a new environment, right? And it's just more of like, okay, this is, the residency gives you an experience to draw from, to be able to be like, if you come across something similar when you're practicing on your own, you can be like, oh, this is something that happened before that I've been exposed to, and I can probably use the same thing. Because the more that we're exposed to things, the more that you'll be able to utilize that in other instances. That's how we get a lot more comfortable when we experience new things, is when we draw from our experiences and we keep repeating that over and over.
Exactly.
Hopefully that helps answer your question, Ag.
It did. Thank you so much.
You're welcome.
Thanks for asking it. Thank you so much, Dr. Gerstell. Do you need to pause, ladies and gentlemen? It's 1:02. We've gone over time. You've been super generous with your time today. Thank you so much for sharing not only about research, but your experiences, your incredible career. Keep up the amazing work. We'll see you on campus.
Yes.
Thank you. Thank
And
you, Jody.
feel
Any
free-
final words? Yeah.
Reach out. I do check my SCNM email. So if you want to, just shoot me an email. I always make myself available to students.
Very good. Thank you so much.
You're welcome.
Awesome.
All right. Bye.